Hello, everyone. I am Tiara, your Wellness Beauty MP, and I am excited to be here to talk to you guys in regards to breast health. So, if you don't already know, I am a family nurse practitioner and I do currently work in women's health. It is one of my favorite areas to work in, and so I'm very, very passionate about talking about women's health as well as the importance of breast health because. Breast cancer has definitely affected me in many ways. I have a family member. My grandmother passed away from breast cancer, and I have family and friends who are also dealing with the same issues. So it is something very dear to me, and I take a lot of time in talking about the importance of breast health and early detection with my patients. So, in honor of Breast Cancer Awareness Month coming up with October, I thought this would be a great segue into having that conversation. So, just a little bit of background on breast cancer or some statistics I thought I'd share. In the US alone, there is approximately over 240,000 people who have been diagnosed with breast cancer, and that is with men included. So, a lot of people don't understand that men can also be affected by breast cancer. And even more so, if you have a male relative in your family that has been affected by breast cancer, that even increases the family risk factor even more. So out of those 240,000 people who have been diagnosed, about 2,100 of them were men who have actually died from breast cancer. And about 41,000 of those people were women who have passed away from breast cancer. So those are pretty high numbers. And a lot of times with breast cancer that we really, really like to push is the importance of early detection. Early detection is key. You hear it all the time, and it's the reality. It's definitely key. And I push this to all of my patients about it, and I think that it's very important and something we talked about. So, as far as breast self exams, we talk about doing our self breast exams. Now it's very important that we push the idea of breast self awareness, just because a lot of times people were doing these self breast exams every month. And we were pushing that, you do your self breast exam once a month, and it should be after your period, because typically before your period or around your period, you have these different changes in your breast tissue, which we'll go over a little bit later. So we push that, making sure you have do those self breast exams. And what they found was just doing those self breast exams was not changing or decreasing the number of women who were being diagnosed with breast cancer. So now we try to push for the idea of breast self-awareness. And what that means is teaching you what's important and what should you be looking for. Because a lot of times, I know for me, when I ask my clients about, or my patients, about if they're doing their self breast exams, a lot of times I ask the questions like, well, how often are you doing them? Do you know what you're looking for? And a lot of people always answer me, no, I really don't know what I'm looking for. People say look for lumps and masses, but I really don't know what that is. Or I've always been told I have lumpy breasts. So for me, it's kind of hard to understand that. So me as a provider, it's my job to educate and teach. So I really wanted to go over those signs or different changes or things that you should be mindful of when you are doing your self-breast exams. So like I said, if you're in a routine of doing your self-breast exam, that is great. I, one for one, do it a lot. And they do recommend you can do it in the shower. Again, it's not just about doing the self-breast exam, it's also about just knowing what you're looking for. So different things that you need to be looking for to show you if you are at risk of breast cancer is, of course, lumps or masses. If you are someone who deal with already having lumpy breasts or fibrotic cystic breast tissue, then sometimes it's kind of hard for you to determine if it's a lump or if it is a true lump or true mass. And I tell people all the time, within doubt, if it's something that feels different, it doesn't hurt to get checked out, because you just never know. A lot of these people who do have these issues, sometimes their provider may even pay a little bit more attention to their breast exams, or even have them do a little bit more imaging and evaluation a little sooner. So, so definitely masses and lumps are important. You also want to look at nipple changes. So when I say nipple changes, sometimes people will see a change in their nipples to where they may be redness, there may be flaky and painful nipples, and they have some redness to it and it's really flaky. Sometimes even the changes as far as if they invert in. So sometimes your nipples can invert in and they may not be sticking out like they normally do. So typically your nipples will protrude outward. Most people do, but when they are at risk of possibly having a diagnosis of breast cancer, sometimes they invert in, and that's a sign that you need to get checked out. There's also some people who actually have always had inverted nipples. So I don't want to scare anyone. Like, if you already always have inverted nipples and they never protruded outward, then that's not a new change for you. That's not a new finding. That has always been there for you. So that's nothing we will worry too much about, because it always has been there for you. Now, if it's something new, we worry about new changes, something that has not always been there. That's what we worry about. So if you have that type of nipple change, you definitely want to get to your medical provider and get an exam done. So there's also the idea of breast pain or breast tenderness. If you have a significant amount of breast pain or breast tenderness, and there is nothing that you could possibly be taking, or no type of injury that you've had, and you just keep having a significant amount of breast pain, you definitely want to get into your medical provider to get evaluated as well. There's also breast tissue changes. So sometimes with breast tissue changes, you may see, again, reddening areas. Sometimes you may see the dimpling type of pattern or texture. A good sign of that could be if you take a look at an orange peel. So if you take a look at an orange peel and you see how that texture has like that dimpling type of texture, that is kind of resemble what you will see, changes that you could possibly see that could be a possible cause of cancer, breast cancer, if you were to see something like that. So that is something you definitely want to be mindful and definitely want to get checked out if you do notice that. So those are different things. Nipple drainage, that's another one. So if you are not pregnant, or if you're not actively breastfeeding, you shouldn't have any nipple drainage. Now, this also goes to, it's different from people who have nipple piercings, because I see that a lot of people come in alarmed. They have nipple piercings and they are suffering if they're having drainage. And ideally, the drainage is literally most times related to the nipple piercing. But again, when in doubt, follow with your medical provider. But if you're having nipple drainage coming from your nipples and you have not breastfeeding or not actively pregnant, that is something we definitely want to take a look at and see what could be causing that to happen. So go to your medical provider. So there's also changes in size. That can be also a sign that something is going on, so you want to get checked out. So the thing about these changes, a lot of these changes can, like I said, can be related to other things. So you definitely want to have a conversation with your medical provider. There are some people who are on birth control or certain medications that could be causing them to have some breast tenderness or breast pain. So a lot of times it's related to that. And I do have that conversation with my patients about, if you do have breast tenderness because if you're on a birth control method that has estrogen in it, you will possibly have breast tenderness or breast pain. So don't be alarmed if that was to happen. There's also breast tenderness or breast pain related to your period. A lot of people have breast tenderness or breast pain once a month around their period. They know when their period is going to come. Of course, you'll have breast changes with pregnancy, like I mentioned. Some women going through menopause, because there's hormonal changes with going through menopause, you may also notice that you have some breast changes as well. So just be mindful of those different things. And that's why sometimes some people don't understand if it's a problem, because a lot of these changes could be related to something that is not related to cancer. So I just wanted to make you aware of some things that could possibly be causing some of these changes. However, if none of these apply to you, or you just don't know, always check and follow with your medical provider. So another thing that I want to talk about is mammograms. So, and also clinical breast exams is another one. So mammograms, let's start there. Mammograms, we typically get those after the age of 40. And when you get your mammogram, you typically should get them every 1 to 2 years. Now, I have a lot of people who do not like to get their mammograms because they say they are uncomfortable. And I am very big on having that conversation with them. And I'm very blunt and honest with them, and I let them know. 10 to 15 minutes of discomfort for this test could literally save your life for you possibly in years of more pain and issues for the next couple of years, or even death if we don't get this screening done. So the mammogram does not prevent cancer, but what it does is it is helping us with that early detection. And the reason why we start after the age of 40 is because typically roughly around age 40 to 45, as you get older, is when we start seeing people diagnosed with breast cancer. There is a small percentage of women under the age of 40 who are diagnosed, but we typically see it in older ages. So we definitely want to make sure that you are getting those screening mammograms done at age 40 once every 1 to 2 years. Getting those done. There's also clinical breast exams. So those are typically what you get done by a medical provider. Every year, every woman should be going to get their wellness checks. Whether you're getting your pap smear, even if you're not due for a pap smear, you should still be going every year to do your wellness exam with your gynecologist or your primary care physician. And at that visit, you should be getting breast exams. So we typically start that at age 25 and up. However, I don't discriminate with age. If you come in at 21 and up for your pap smear, which guidelines have changed that, but that's a whole nother story. If you come in at age 21 and we're doing your wellness exam and you want a breast exam, I do it. Or even if you, even if you don't want it, I still have that conversation about breast awareness and what you should be looking for, because I think it's very important. And it's part of your health. So I do have that conversation because I am very big on getting in your mind and already getting into that routine, no matter how young you are, to already know that this is what's healthy and this is what's going to keep you healthy. Or early prevention, early detection. We want to start that conversation early with our children. So I'm very big on having those conversations with my younger clients, or my younger patients, I should say. So then there's also the idea of risk factors. So sometimes with mammograms, you will see women starting at age 30 getting their mammograms a little bit sooner because of their risk factors. So different risk factors that we look at is if you have a first degree relative who has a diagnosis of breast cancer. So typically that is your mom, your grandmother, sister, or aunt. Those are typically first degree relatives, or if you have multiple family members who have a diagnosis of breast cancer. And again, if they are diagnosed at an early age, under the age of 45, then that even puts you at more higher risk. We also look at genetic testing. So if you have the BRCA gene, the BRCA1, BRCA2 gene, we look at those. So if you have that gene, that also increases your risk of breast cancer. Again, going back to what I said about any male relative with a diagnosis of breast cancer, that also increases your risk for possibly having breast cancer. So also keep that in mind. We also look at the risk of ovarian cancer. If you have first degree relatives or a significant amount of people in your family with ovarian cancer, we also look at that because that's also a risk. Or even if you have ovarian cancer, that puts you at risk as well. So just keep that in mind as far as risk factors. We want to take a look at that. And if you have someone if you have the first degree relative with breast cancer, a lot of times we do recommend you get genetic testing done depending on your risk factors. So that is something you also can have a conversation with your medical provider as well. So going back, early detection is always key. please understand the warning signs or things you should be looking for. If you have any of these issues, follow up with your medical provider, whether that's your gynecologist or your primary care physician. Also, if you don't have a medical provider, Planned Parenthood also offer the services of breast exams. A lot of people are not aware of that, but they will. So if you have any breast findings, whether it's a lump, a mass, any significant amount of breast tenderness or breast pain that's significant and it won't go away, and it's consistent, you want to get that checked out. If you're having any nipple drainage or breast skin changes, anything of those things that we discussed today, make an appointment with Planned Parenthood. They will get you in. They will do an exam. They have nurse practitioners that are highly qualified that will do the exams for you. And then any findings that they do find, they will send you out for imaging to get done, whether that is a diagnostic mammogram or they will also send you out for a breast ultrasound depending on age. So that just depends on your age and what they find. They'll send you out with the order to get these testing done. And then once the information comes back and you get that imaging done, what they do is they have someone read those results, and then they get in contact with you if anything is abnormal, and will set you up with referring you to a breast specialist if that is a need, depending on the findings. They will, if they don't find anything, they still will follow up with you, have you come back in just to make sure everything is okay. They are very attentive in that aspect. So if you don't have a provider, I highly recommend you utilize Planned Parenthood to make sure that you're okay. Or if you can get into your doctor. A lot of times doctors are booked up and it's hard to get in. And I know I couldn't imagine feeling like I have a breast lump and it's going to take me 2 months, 1 to 2 months to get into my doctor. So you can also follow up with Planned Parenthood. They can do the exam, and then you can already have your imaging done, and your doctor, by the time you get to your real doctor, they will already have the information needed to see what the next step will be. So again, that is early detection. I also do have some information here in regards to where you can go for these resources. So a lot of times, a lot of people don't have insurance, so what I did was I looked up, and I actually, we send people to these places as well who don't have insurance. So a lot of times people don't have insurance, and that's another reason why a lot of people do not follow up and getting their mammograms done. So do not do that. There are a lot of resources out there that you can look into that will help you get your mammograms for free. So there is freemammograms.org. You can go there. They have a lot of resources based on your area where they will tell you where you can go for a free mammogram. There's also a program called Muffins for Mammograms with Cleveland Clinic, Akron General. I send patients there all the time. As long as you have an order, they will do the mammogram for you, and it is for free. So the number I will put in the comments, but real quick, I'm going to give you that information too. So the number for Muffin for Mammograms with Cleveland Clinic, Akron General is 330-344-2462. Make an appointment and make sure you do have to have a doctor's order for that mammogram. So this, again, where you can get it from your regular doctor, or you can go to Planned Parenthood and they will provide you with an order for your mammogram if you need to get your screening mammogram done. Okay, so if you're due for that, please get that done. And then there's also the Ohio Department of Health have a program as well known as the Breast and Cervical Cancer Project. So they also will help with resources for your mammogram based on I believe there's certain criteria you have to fall in line with to do it, but it doesn't hurt to call and find out if they will help you with these resources. And I do also send people this route as well. So that number is 1-844-430-2227. So again, that is 1-844-430-2227. So again, I will put this information in the comments below. And I want to thank you all for listening in. I hope you learned something today, and I really hope I touched someone and really, really made you realize the importance of early detection. Do not be scared, because technology has changed, medicine has changed, and there's a lot of people whose lives are being saved because they decided to get their screenings done early. So never be afraid to make that step. And if you have any questions, you can always shoot me an email at info@serenebeautywellness.com. Also follow me on all social media platforms. We're at Serene Beauty and Wellness on Facebook, Serene Beauty _ wellness on Instagram, and we're also on LinkedIn as well at Serene Beauty and Wellness. So you can always hit me up at any time, or you can leave a comment, and I'll be sure to get back with you and help you any way that I can. Thank you so much for listening. I appreciate all of you, and continue to subscribe. Go ahead and subscribe to my YouTube channel, because I will be doing more videos like this, educational, whether it's regards to wellness or also some aesthetics and some of the services I provide. So please subscribe. I would really appreciate it. Thank you. Peace and love. Bye, y'all.